I'm Dr. Unmil Shah, transplant pulmonologist at Global Hospital, Mumbai. Today I'm going to speak on lung transplant. First, understanding what are the types of lung transplant. So worldwide there are three types. One is a double lung transplant, another is a single lung transplant, and the third one is a combined heart lung transplant. Coming to the indications. So first, the general indications. So patients with end stage lung disease who are having a deterioration with a respiratory failure and who have medically a chance of mortality risk of more than 50% in the next 2 years are the ideal candidates for undergoing lung transplant. Coming to the disease specific indications for the lung transplant. First common indication is interstitial lung disease, which is commonly called as lung fibrosis, where the lungs become stiffer and smaller in volumes. The second common indication is COPD, which is called as chronic obstructive pulmonary disease, where despite medical therapy, if the disease progresses and causes respiratory failure, becomes an indication for lung transplant. Third is bronchiectasis, where the airways become dilated and infected, and if it causes respiratory failure, again becomes a strong indication for doing a lung transplant. The bronchiectasis can be related to either cystic fibrosis or non-cystic fibrosis. Fourth common indication is idiopathic pulmonary arterial hypertension, which means the right side of the heart is weak, has very abnormally high pressures. So if the cardiac functions are preserved, such group of patients can undergo a double lung transplant, but if the cardiac function is compromised, ideally such group of patients undergo a combined heart lung transplant. Coming to the preoperative care, usually such patients, when they are listed on the transplant list, we advise them to undergo an extensive pulmonary rehabilitation, maintaining their calories and proteins, having a diet plan which is accurate, and getting vaccinated. So these are the three main points which are always important as far as the preoperative care is concerned. Such group of patients which undergo lung transplant, usually they are dependent on home oxygen. Some of them even require BiPAP support, which is a face mask, which helps in work of breathing. Such patients usually have a progressive deteriorating lung functions on spirometries, and they usually on 2D echoes have a moderate to severe pulmonary hypertension, which means the cardiac pressures are on the higher side.